An estimated 30 million Americans have sleep apnea. And in tonight's 12 Health, we're talking about a relatively new surgery here in Rhode Island for those patients. Sleep apnea is defined as recurring episodes of partial or complete airway obstruction during sleep. A CPAP machine, which has a large mask that goes over your nose and mouth while you sleep, has long been the prescribed fix for these patients. But the Inspire device changes all of that. It was approved by the FDA 10 years ago, and Dr. Ian Newberrry with Rhode Island ENT and Brown University Health was instrumental in bringing it here to Rhode Island in 2024. He joined us on 12 Health to explain how it works.
It is a device that actually goes into the neck as well as the chest. One, we make a tiny little incision in the neck and we actually go down to the nerve that controls your tongue. The cool thing about the tongue is there's different branches of the nerve. There's one that sticks out your tongue, one that pulls it back. We were looking for the one that sticks out your tongue. There are also branches of that nerve that come off that also stimulate the airway, that are going to be tighten up the airway to make sure it's not kind of just lax while you're sleeping. It's also going to be when your tongue comes forward, there's other things that pull your palate forward. The thing, the uvula and everything that kind of dangles, that is going to be pulled forward, among other things that'll just be tightening up the airway. So we're putting this little cuff. It's like a little, for lack of better terms, like a cover that just goes around the nerve. We then will tunnel that underneath the neck down kind of into the chest, where there's actually a device in the chest. It's kind of similar to a pacemaker. You're breathing out, that's when the collapse usually happens, and the little device will tell your tongue as well as everything else to kind of tighten up and go forward.
He said the success rate for the Inspire device is in the 90th percentile, and it is covered by insurance, but you have to go through a sleep study first to determine whether you qualify. The device is also customizable to each patient, and the surgery is a quick outpatient procedure. You can learn more about it in this full episode of 12 Health on the 12 Plus app next Tuesday, August 5th. We also have a link to Inspire's website on WPRI.com.